We take you live now to the Ontario Legislature, where question period is now underway. Let's listen in.
I think to groups like SEIU. This was a group, colleagues, that protested outside my office, but we sat at the table with them, we worked with them, and we've reduced dependency on agency staff through supporting them for meaningful careers. And I've quoted in this House what the president of SEIU had to say about the Skills Development Fund. We'll keep working. Without question, we have more to do, but we're relentless in our pursuit to make things better for the people of Ontario.
Supplementary. I don't understand how things get better for people if you're giving them $18.6 million to a company with that kind of record. I mean, the government members say they want us to talk about people. I'm going to do that, right? A 61-year-old patient who relied on catheter supplies was given the wrong size tubing. That patient suffered excruciating pain. Just imagine the suffering for a moment. The government knows these stories because we raised them with you day after day after day. Patterns of mismanagement, patterns of neglect. So back to the Premier, please explain, how did Bayshore Limited, after these cruel, absolutely catastrophic failures, qualify for $18.6 million in funds?
Minister of Labour.
You know, Speaker, I think it's important to work with every single healthcare partner in the province of Ontario to make care better, closer to home for the Ontarians we serve. You know, in my own community, Speaker, I think of the challenge we had with nursing staff. I think of the merging of the inpatient units under the previous Liberal government. And we sat down with them and we worked hard to reduce dependency on agency staff, Speaker. We worked hard to train more nurses. You know, this government is relentless in that, sitting down, working with partners to improve it. Through the Skills Development Fund, as I said, 52,000. We've taken 100,000 people off of unemployment, given them meaningful careers, Speaker. Aging population. We got to attract people to care for our aging population. Not everyone wants to do it, but this government is supporting meaningful pathways for those meaningful careers. We're going to stay focused on doing that, Speaker. Every single investment we've made in healthcare, in increasing the number of hospitals, long-term care facilities, they voted against.
Final supplementary.
We've been briefly listening into question period underway down at the Ontario Legislature. We'll have more on that throughout the morning and afternoon.